So it's 10 o'clock sharp. We in Germany start right on time. Welcome and good morning, everyone, for joining our first Digital Health Talk. I'm very happy to have you as guests. Maybe you have already joined the Hanover Deep Dive events last year. This year, we developed the format further in having it a little less formal. No PowerPoint slides, just a nice talk between companies, further on also research, all around the digital health scene in Hanover. We want to connect with each other, we want to learn more from each other, and maybe find even a potential partner. My name is Cornelia Körber. I'm project director at hannoverimpuls. hannoverimpuls is the economic development agency of the city of Hanover and the region. So why are we doing this in English? It is not only meant for people in Hanover. We're very intrigued to have our voice also heard outside and find partners abroad. So in my job at hannoverimpuls, I'm building bridges for companies specifically from the Nordics, from Israel, to come to Hanover and for them to understand us. All three of us today are giving up our mother tongue and we just do it in English. What's the topic of today? The topic of today is medical practice solutions, the age of digital dental clinics. Therefore, I'm very happy to have a guest directly from the field who knows everything about daily life of a dentist, Axel Rinnert. Warm welcome.
Thank you very much. I hope my English is sufficient for today. I'm very looking forward to it.
I'm very sure it will. Our second guest is Meyer-Spradow. He is COO of Medondo. Medondo is a digital health startup in Hanover, and they are working on, and they have just launched the first product of a medical practice solution. Warm welcome, Kai.
Yes, thank you very much. And thank you very much for the invitation.
So directly diving deep into the topic. Kai, I know that you've been researching digital dental health or digital solutions around dental health for a while, since I think 2009 already. And Medondo has been founded 3 years ago. And you've just launched in January your first software application, which is fantastic. So does this mean after all this work and the big launch that we have now reached the digital age of dental solutions?
So in the past, we saw that in doctor offices, you have a lot of several software solutions, and it's very hard for the doctors and for the assistants to combine everything because you do not have the sufficient interfaces between them. And that is the reason and the vision of Medondo. So we will build a software which connects everything together so that you can do everything that you need in a doctor offices. Mm-hmm. And this is first product. It's a Dondo Coordinator. You can coordinate your treatments with the patients. So it's a solution with a scheduler, with a patient record, with a video conference system, and with a patient portal. So it's very cool that you can just send an invitation to your patients and the patient can do a login. Then you can exchange some documentations, you can do the video conference system, and you're able to just make your next appointments due to the interface. And
so that means I, as a patient, I have a range of opportunities to do things completely different. If we make it a little bit more concrete, one example. So if I would make an appointment at an orthodontist, how are things different than they were before?
You can change it completely. So the thing is that you can just make an appointment via the internet, via your web browser. You can get questionnaires from your doctor. You can answer the questionnaires. You can make a video conferencing so that you're very well prepared before you're going to the doctor offices the first time and meet you physically. And that's a big change in the communication between patients and doctors.
Absolutely. I completely understand this for a patient. Alexander, now as a dentist, and I know that the dental clinic that you're working for, Zahnschlösschen Uelzen, is already using this software application. How does this change the daily life of a doctor and of the whole team, of course, behind in your practice?
Yeah. So first of all, the team effort is, of course, very important always when integrating new software. I think the view in dentistry is that most of dentists are always very tech fascinated. So we have always been very early adopters of, for example, 3D printing and other new technologies. But now what's really happening is the age of digital medicine. That's of course disrupting not only dentistry but all fields of medicine. And most of the people say in dentistry and medicine will change more in the next 10 years than it has in the last 40. And I think what Kai just described is the possibility to link everything together in one software is really, really important to really go this change in a way that we can still perform our daily tasks in the clinic.
So it's a little more concrete for me as I haven't worked in a dental clinic, and now that you have the first software application, is there a concrete example of how things worked before, say, still November, December last year, and how things changed into now launching the product and working in January, February this year?
Yeah. So in our clinic, we didn't have online scheduling before, nor did we have really the need or the demand for video conferencing. As this is now all in one platform, has changed dramatically. But also there are other teledentistry solutions that are directly linked in the application of Medondo that make, for example, dental or patient monitoring easier. Mm-hmm. And that is directly linked to the patient record as well. So it makes them for much more sufficient digital workflow. Mm-hmm. We call that the phygital practice, so the physical and the virtual practice. And the before we didn't have the phygital practice. We had maybe some virtual solutions, and most of them were physical. But now we are on our way to the phygital practice.
Thank you. Talking about on the way, Kai, what is your vision? Where would you like to land with the coordinator or with the next steps? Quite briefly, what's the vision for Medondo?
So the vision of Medondo is to just make a software that is process-oriented and that will help the doctor and the assistants to do their work, because they have to do a lot of work with paper. They have to do a lot of this documentary. And if you go into a practice, then you can see that there's a lot of copy and paste. So copy some data from one system to another, but it's not needed because you can just do it automatically. And that is the vision of Medondo, just to have smooth processes from the beginning, the first contact with the patient, until at the end with the finance stuff and with statistics and all you need to just run a doctor office.
Right. Alexander, I would like to know, how did it come that you as a dentist decided to join up with a digital health startup?
Yeah, so I joined the practice from Professor Demling, Zahnschlösschen, in 2019, and I'd always been fascinated with digital solutions from a market perspective, so that the electronic patient record can really help reduce patient information asymmetry and therefore also the demand for high quality dentistry. And I think that's a really, really big point that we need at the moment. And so I was always fascinated with that. And of course, then I learned about Medondo through Professor Demling. And we gradually went from project to project, and I got more involved step by step. And I'm really enjoying it. It's really a fascinating field. And it's just makes fun to talk not only to people from the field but also from e-health, digital health, and all the designer, the product owner, and so on. So Absolutely. There's a lot of really cool ideas that you can share, but also to connect with other digital-minded dentists and doctors. That's also very, very interesting and very, very cool.
Yes, I can definitely see that point. And I believe that Kai is very fortunate to have dentists and directly real expertise from daily working life in his company. Another big influencing factor is something that everyone in digital health is talking about these days. It's the electronic patient record, right? It's been rolled out in January this year. We have the full rollout in July. I don't want to open up the whole discussion, otherwise it's going to be another 2 hours that we can talk. So quite specifically speaking, Kai, this introduction and this development, is this helping you with Medondo, or is this something where you say there are also a few hiccups happening?
So I think that it's very helpful to have this the idea of the electronic patient record, because we have the same idea, so we are going in the right direction. But on the other side, it's on a detailed level, it's not very clear what's coming up. So the politician might be or would very good to get more concrete idea what they would like to have and what's the need for that. So actually, it is more that we know what we would like to have and what we need, and so we will build that stuff. But and we hope that both match together at the end, but we are not quite sure about that point at the moment.
Mm-hmm. Is there a certain step that would help you in that process further?
Yeah, actually, one very big step that Germany just did is the Snowmate catalogue. So that is an international catalogue where you can just make your diagnostic on an international coding standard. And so we are very happy that Germany joined this organization at the beginning of this year, and that's very cool for us because now we can use it. And I think that's a very, very big step on the way of an electronic patient record.
Mm-hmm. I was reading that it was only introduced last year, 2020, in Germany, and that triggers for me the question, where do you see Germany there in an international comparison when it comes to Snowmate?
Yeah, actually, I think on an international level, they're far beyond. So it's that we have to invest more time and more energy in that area, and it's very good that we can do it right now, but we are very late at that point.
Mm-hmm. And maybe for someone who is not so much involved in digital health coding, where do you see the benefit with Snowmate? What is it directly? Why is Snowmate so important for you?
Can I?
Yeah.
Yes, please.
So from a clinical perspective, yeah.
Yes.
Obviously, if you have all this digital data, so we have intraoral scanning, we have radiographs, we have all the data that we want to combine for a more sufficient and comprehensive view on the patient. Maybe also do some risk monitoring. Mm-hmm. We need this data to be labeled in a way that these views can be talking to each other. And then we have a very, very big thing in dentistry that's happening for the last years is intraoral scanning, and it makes something like a 3D model of the teeth, and it's like a digital twin in the end, because we can then to that intraoral scan and to that 3D model we can pin all the other information that we have about the teeth, and it's a very sufficient room. It's very complicated in there, but it's if we have all the data, and the information gets really condensed and very interesting. And of course, now we have all these AI applications that are happening, not only in radiographs, but also in other fields. And it just makes for better data, and that's very important in the future.
Mm-hmm. Great. So I understand that with Snowmate, you have the possibility to actually use also new developments. So if you are using AI, if you get more condensed data, obviously you need a means of communication to process this. And that is what you need Snowmate for. And this is why it's so important for you. So I think this is very good for everyone to clarify this. And how can we help to have a little bit more speed in the introduction of Snowmate, or is there anything that you in particular would need to say this would help us?
So actually, I think at the moment it is the doctor makes a diagnostic and it's written down via normal text, and that's very so it's not possible to just transport these data from one system to another with interfaces or something like that. And that is where Snowmate is made for, so that you can just interact and exchange the data between different systems. And I think here in Germany, we are looking forward for having international connections and having international communities, so that we can just exchange and have discussions about the Snowmate code and getting best practices here in Germany. And that's what we are looking for or searching for.
So I know we'll get back to this later, but already a big exclamation mark on my side to this. Everyone who hears this, if you know about Snowmate, about those technologies, we need networks around it. And internationally speaking, I was also quite intrigued to find out that your application is not only available in English, but also that you have a Spanish version almost ready. Is that right?
Yes, that's correct. So our the technique behind Medondo software is a cloud-based software solution. So we are making this as a software as a service. And of course, for that, we just implementing international solutions. So you have an English version, you have the German version, of course. You have almost a Spanish version and the Russian version also, yes.
Mm-hmm. Wow. Now that we talked a lot about international perspectives, coming to a more national one, and with a patient focus, what we need that we know that there's a lot of change happening. There's change happening within the area of dental health. So I read that almost 50% of all dentists are going to retire in the next 5 to 7 years. So this is a huge number. Even if that number that I read was only half correct, it would still be a huge challenge. Of course, we know similar problems from the family doctor areas, and the buzzword, I will not ask the question whether digitalization can help. I think we all know that this is one answer, but asking more directly, how can those technologies that you are touching upon help with this situation? And how can you with Medondo maybe make a step towards helping that challenge?
Alex? So, before that, for the medical persons hearing, of course there's ICD and OPS, but in Germany and most of dentistry we don't use it. So ICD hasn't been developed for dentistry. So at the moment we're really using only free text. We don't code more or less at the moment. And now if this change with Snowmate and all the digital data is happening, we of course can much more interlink with the medical field. So there are connections, for example, in elderly care between periodontitis and diabetes or cardiac problems or Alzheimer. Mm-hmm. And this has been shown in studies, but we don't have real world data. Because the data is more or less not really sufficient to use for this, and this change therefore can also be a really huge opportunity. That with new maybe practices or more open-minded, more younger dentists, we can have a view that dentistry can be more connected with medicine, and that maybe this is also a buzzword, value-based healthcare. But maybe we can have this view that dentistry can also complement medical care. And if we have this view on dentistry, I think this can and has to have this effect, because as you said, not only are dentists retiring, but also, of course, our population is getting older and older.
Exactly. I was just coming to that point, because I'm thinking the typical way is that we think, digitalization is the solution, and then we're all getting older, and we know that people who are getting older are catching up with digitalization, but not as fast. So when it comes to using those technologies, where do you see an answer there?
Yeah, so I think we can use a lot of things that we are also already experiencing and testing and establishing in orthodontics, especially in teledentistry, where it's much more advanced. And my view is that we can bring most, but at least a good part of it into elderly care, and use teledentistry to monitor, to document, and maybe even later to have a better view on the patient and then give better care. And we are actually thinking about, of course, how to implement that. We have different cooperations with an Humboldt Institute in Berlin, or with all the universities that they have come together to work on how does intraoral scan data for which use cases can be implemented. So the questions we are asking are all going into that direction at the moment, and it's very, very interesting.
So there are a lot of opportunities ahead of us, and thinking about the digital age of Medondo, I think you enter the digital age of dental clinics with Medondo, that's how it is, has started, and we see that there is a range of opportunities to go. I'm now interested a little bit again in the business side, because Medondo is a digital health startup in Hanover. You founded here. Now you launched your first product. Kai, as COO, I would be interested to hear what are your experiences? Where do you see a lot of benefits? What's helping you that could also help others to know?
Yes, so actually, to be a startup here in Hanover, it has two sides of a medal. So the first thing is that I think Hanover itself is underrated. So of course, we are not so famous for a very good and big startup scene. So it's not so famous as Berlin or Cologne or something. But on the other side, it's very familiar here, and it's very cool that you have very good networking and connections, and so that you have a network that helps each other, and that you know a lot of people here, and that it's easy to get access to professionals, engineerings, and so that's very cool here in Hanover, especially.
You have there a specific example, like anyone that made it very? I mean, I see the close collaboration to Axel Rinnert.
For example, yes, and for my career, I have a lot of connections with my old colleagues, and so we meet each other, and so there is a very, very good network, and we have the same mindset for the same vision and the same ideas, and that makes us so strong that we have very, very good team that works on that very difficult topic, and but we are very fast in that and very successful.
I see that our time is running as crazy. This is how it is when you have good conversations. Unfortunately, we don't meet at bars and coffees so long, so I think that's why it's so much fun to talk here. Coming to the end, I both would like to give you the opportunity to state a wish, and maybe because it's the first digital health talk, even two, about what would help you. So our audience are researchers, are other companies, we have politicians, we have cluster organizations reaching out into the Nordic companies. So let us know what would you want, what does help you?
Yeah, it would be very cool if you can get a network and connections to other companies working on the same direction or on the same topic. And that would be really cool, especially in the Snowmate or fire environment, so that we can just get a conversation about that. Mm-hmm. Yes, that's very important and very for us.
Alexander, quickly a wish from you.
Yeah, of course, first of all, fire and Snowmate, but also then as we have a patient portal, cloud-based, this is also very important for shared decision education, and there are very, very interesting use cases. And I think, as you said, the Nordics countries they're far ahead in that implementing of that solutions, and it would be very interesting to share use cases for shared decision education, how to use data, information, and so on in the information and patient portal. And use that not only for dentistry, obviously, but in a broader context.
Yes. Thank you both so much. I hope that people who listen to this have the means to help you. We know that Snowmate is important, that international collaboration is important, that the integration of data is important. Maybe someone listened and said, this is exactly what I need. Or maybe someone wants to invest money in you. I heard that is not too bad either, right?
Yes.
And then I see that my backup team has already prepared the slide with getting in contact with you. So both of you are very much present on LinkedIn. So if you now listening to this want to reach out to Kai or to Alexander, feel free to connect via LinkedIn, or you can also see the email addresses displayed. A big, big thank you to both of you. It's been great having you. It was very fun to talk to you. Thank you.
Thank you too. Thank you very much. It was fun.
Then everyone can also see my contact information there. It's already off. We'll stage this next time a little different. So if you want to be my guest in the future, please reach out if you have any comments, also on LinkedIn or on my email. Finally, after the game is for the game. That's how much we know. And the next game is on April the 30th, where we will talk about the topic of future rescue, the digitalization of rescue services. There, I'm very happy to have another two great guests with me. one coming from the PLRE Institute of MHH, which is the Medical University in Hanover, combined with Technical University Braunschweig, Thomas Deserno. He is researching a lot all around emergency medicine. And then as a second guest, I'll have here the company Graphmasters from Hanover, and they are very much involved into digital traffic guidance. So I think you can already make the dotted connection between emergency research and digital traffic guidance. We'll talk a lot about it. Also, again, we want to talk a lot about how we can help and what partnerships will be needed. Thank you so much for joining. It's been a pleasure, and it's already Friday, so happy weekend, everyone.
Thank you.
Thank you. Bye.